And we will begin our Human Services Committee meeting with public comment. Is there any comment from the public?
You going to approve the minutes?
Where am I here? Yes.
Okay. It's all right. It's
I
early.
beg your pardon.
It's early.
I move for approval of the minutes.
Thank you.
All right, support.
All in favor? Aye.
Aye.
Now we will have public comment. Seeing none, we will move on to the Health Department. Mr. Kiesler.
Good morning.
Good morning.
Fred Kiesler, Health Officer, Grand Traverse County Health Department. This morning I have a couple of contracts for your review and some contributed money and an update. The first being Dental Services Agreement Amendment Number 12. We've been having this relationship for some years with Northwest Michigan Health Agency for our dental program when we consolidated with them. In this, we annually have a liability of $23 per unduplicated person served under the Medicaid program. And then in the notice is that this has been suspended until further notice. So in other words, we have a liability that we budget for, but we haven't had to pay that for some years. And in addition, to receive $45,067 to do a community outreach for the dental program, which we use to promote the dental program within our context of our programs. And so to receive this money and have this contract approved, I need your approval.
Move for approval.
Second.
We have a motion. Discussion.
So we've never paid this $23, or?
I think we did the first few years, it was about $40,000, but
Okay.
then they've been able to stay a nonprofit organization. They've not required us to pay that, but we budget that money in case we need it.
Okay. So how many unduplicated patients do we see in our dental clinic?
I think it's around 3,000.
Okay. Good. That's all.
All right. Yes, Dennis.
This is a general question, Fred. I went to my eye doctor yesterday, and when you get there now, they ask you for your driver's license. They check your ID. Is that something that applies? And they said it's a new federal law that all medical doctors now, when you go, you're going to have to check to make sure. They're looking for Medicaid fraud, Medicare fraud, and they are now going to check your driver's license. Is that something we are required to do in the health department when we see clients?
I wouldn't initially get signed up for programs, but I can't say we do it for every service.
Okay. I just wanted you to check into that because they say every time you come in for any appointment with a doctor, you're going to now have to show your driver's license.
Really?
Yeah.
So I was at the doctor last week, and we didn't.
November 1st.
Oh, okay.
Wow.
So I just
before
wondered, so
November
if that applies to
Yeah.
us.
It's good you got in when you did.
Yeah, gee.
Okay. We have a motion. All those in favor, aye? Aye. Opposed, same. Motion carries.
Well, we received a contribution of $1,398 from the estate of Lewis and Viola Reno of Kingsley. This money was donated for the Children's Special Health Care Services Program, which we've received money from estates like this in the past, and we give to special needs children that are not covered under the state funding, such as wheelchairs and ramps and other needed things for their care. And so I need your approval for acceptance of that.
I would move to accept the grant of $1,398.
Support.
We have a motion. Discussion. All those in favor, aye?
Aye.
Opposed, same. Motion carries.
For our Department of Environmental Quality Local Health Department agreement for fiscal year 2008-2009, we have the funding from Michigan Department of Environmental Quality. I guess it's MDEQE now. They haven't, as you know, they've been consolidated with, or no, it's DNRE instead of DEQ. And this is for an array of programs. And on the introductory notice says page something, but it's really page 30 of your that kind of gives an outline that $29,755 is for water quality regulations, a small amount for operator certification, and $600 for capacity development, which is part of the public water program. Long-term monitoring, we have some contaminated wells that we collect water samples for the state. We don't get any Great Lakes beach monitoring money because that goes to the watershed folks. So they have a multi-county. Public swimming pools, we receive $3,420. Septic inspection of $1,000, and campground requirements. This was down, not very much, it was like $1,300 and some odd dollars from previous year, 13-14. These are mostly just federal funds that are passed over to us for these environmental programs. And so I need approval for this contract and Mr. Thomas's signature.
All right, I would
Move
entertain a
for approval.
motion.
Second, excuse me.
We have a motion and support. Discussion.
Just a
Dennis?
question, Fred, why is this called why is it for the fiscal year 2008, 2009, but we're signing it for 2009 through
Well,
2010?
Excuse me, I think I misspoke.
No, that's what it says in the
That's
letter.
what it says.
I didn't know if that was just some quirky thing.
It's in the
that state
subject as well
requires.
as the, at the bottom.
It's a 9-10 grant?
Yes, it is. I think
Right.
it's just
Must be
a
a typo.
Oh,
Sorry,
okay.
I read it wrong.
9-10 grant.
The letter to me from DEQ says fiscal year 2009, 2010.
Okay.
All right,
Typo.
Sorry about that.
Page 17, the contract.
okay. We have a motion and support. All those in favor, aye.
Aye.
Opposed, same. Motion carries.
And then I was going to give a brief update on H1N1 process. As you probably know, a week ago Sunday, we had a large public clinic. We had planned a number of school clinics, and of course, we've been dispensing vaccine to the hospital, the medical control, and a variety of physicians' offices, and retaining vaccine for ourselves. And of course, it's been widely broadcast, the fact that the amount of vaccine promised didn't come through. We canceled last week's clinics for the schools, but we were getting messages both directly from the CDC and from the state to try to get what vaccine we had out as soon as possible because of the number of, as the epidemic was spreading quicker than we had hoped. So we had one large clinic at the mall, which you're aware of, and we vaccinated around 924 high-risk people, mostly pregnant women and very young children. That was a great success, and a lot of thanks to the mall for the use of their facilities and inconveniences. Then this week, we started vaccinating at the schools. Yesterday, we started at West Junior High. We vaccinated around 230 students, and we'll be going back there again to pick up those that we didn't get. And then also last night, we did Westwood School. We did over 200 there. I got a call. I talked with our coordinator in the field last night. Overall, we've received around 4,900 doses that we've been either using ourselves or dispensing through the others that are either we have gotten, we've given out, or in the pipe to receive. And we were told in 2 weeks that we're getting up to the amounts of vaccine that we were promised originally. So, be that said is that it seems to be progressing. We've got a number of clinics yet this week and next. We may have another special clinic at the mall for the schools that we missed that last week to get caught up because the Christian, Catholic, and the 3 academies were missed, and so we'll try to make up those. So far, it's gone really well. We get, one call, someone's unhappy because their child's school is one of the last ones to be done. I think, how do you, somebody's going to be last, no matter how do you do this, someone's going to be last in line, but we tried to do it as well as we could. We're going to probably put one nurse dedicated to doing set times for, try to get those children older than 6 months to school age at the health department, and just have certain times people will come in and get immunized. And we're doing pregnant women and children as they come in for like WIC services and family planning as it goes into it. Those are methodical and slow, and not big push like having these events at the schools and at the mall. But so we're kind of going in several directions at the same time to get the vaccine out as much as possible. The closings, of course, was a lot of extra work of just coordinating with the schools. Schools are very cooperative. They have been reporting the number of children ill daily to us, which are not required to do that, but we worked with them on these closings. We hadn't had to mandate any of the schools to be closed. It was pretty much a joint decision between the school administrators and us as to what it was. There is no magic number. It seems like when we were getting between 20-25%, but what was happening is while we were discussing it, usually is the school nurse or the principal said, yeah, we got a whole line of kids outside the office or who had just gotten sick since this morning at school and waiting for their parents to get them. And so we knew that the absenteeism was growing almost exponentially. At one school, they had around 68% of the kids were out by the time they closed.
Wow.
And so, now that does not abate the problem, it just delays the problem because as they come back now, our reports of absenteeism are down significantly yesterday, back to what would be like normal for this time of the year, but that doesn't mean it's gone away, it just means it's been delayed. And so, as we vaccinate, that'll hopefully retard, not end more kids getting sick because it'll break the chain. It does take, they say 2 weeks to get a pretty robust response to the vaccine in 10 days usually, but just as soon as you're immunized, you're not immune. It takes a while before the immune system kicks in. So that's where we're at. I think that everyone in the staff has pulled together really well, and like I said, the school has been very cooperative. It's been very good. There's one thing.
Yeah, you made a comment about you expect to receive the rest of the vaccines in the next couple of weeks, on how much you were promised. How much have you been promised?
I can't tell you a number off the top of my head. That number's vacillated a bit over time, so I can't exactly state that. We're talking about 50,000 doses originally. I don't think they're going to manufacture enough to distribute that much. I think it's going to be somewhat less than that. But at least they said that the rate is going to be distributed. The manufacturers claim that they'll get the numbers up. The other thing that's going to happen is our seasonal vaccine should be coming in soon also. And so some of these clinics, we may be doing both the H1N1 and the seasonal. Yeah.
Question, once you get through the risk areas of the elderly and the children, do you think you're going to have enough supply to offer to the general public?
Well, we had planned to have some in December and into January if we get enough vaccine to the general populace, yeah. But I don't know how many we're going to get.
Does anybody else get allocated, like physician offices and those kinds of things? Do they have supply?
Oh, yeah. We've given out considerable amounts to pediatricians, family doctors, obviously OBGYNs that they're pregnant.
All right.
And then we just allocated to allergists, internal medicine clinics, and endocrinologists who would be taking care of like diabetics who in their risk group of people over 24 years old but with other conditions such as diabetes.
Okay.
One last thing, this is kind of a public thing, is that we've been working with the prosecutor's office on this a little bit, is that sometimes, and this H1N1 was an example of this, but we've had this come before, when we get requested information, and we just have a limited number of people ill from something, of us getting either questioned by the media or even FOIA'd by the media about how, like when we only have a 2 or 3 or 1 person ill or something, and there's a rumor of it going out of how much information we release, and we've always been, we're not going to give out the name and the address, but we have been bouncing around and said, well, should we give the age or the gender or the general area where they live? And what's happened is that individuals have come back and said, geez, I could tell, my neighbors, so I knew that was you. Was that you in the paper or something like this? And so we talked with the state, and what the state has done is that 5 or less people, they give no identifiers to that, so if you had 50 people were ill of some disease, and we said, and they rate age range between 3 years and 50, and half are male, and so forth, that doesn't really help identify an individual. But when you have one case or 2 cases, and you say, well, it's a male, 26 years old, so forth, then it's this small of a community it is. So we're going to follow the state's lead that if there's 5 or less people, that we're not going to give out any identifiers, just to acknowledge that we've had a case. And I've talked with Bob Cooney about this, and he has supported that notion. So I just wanted to make it as a public thing that we're going to do that, unless you have some question or problem with that.
No.
Okay.
All right.
That is it.
Thank you.
Thank you.
Next, we have Georgia, the Commission on Aging. And George, good morning.
The George and Georgia team.
Yes.
They noticed I'm not Ralph Safardini.
No, you're definitely not Ralph.
Good morning. My name's Georgia Durga. I'm the Director of Grand Traverse County Commission on Aging, and I brought with me today, not Ralph Safardini, because he was unable to attend, so I brought with me George McBath, one of our other Commission on Aging board members. So thank you, George, for attending. Next, we have our program report. We're through the month of September. This report is through the month of September. Our calls, as you can see, we continue to get calls on visits for services. They keep going up, and we kind of expected that with the other services and the community decreasing. We thought we probably would see an increase in requests. Homemaker aid, we have a person on medical leave, and we're still a little higher than last year. Once she gets back, we'll be able to add quite a few more clients to our service list. Our home health care program, we don't have a wait list. It's, that program goes up and down depending on people going in the hospital, going in long-term care, going to live with family, coming home. They're a little more frail of a population, so they kind of come and go out of that program. Respite care was up. Home chore, we had a seasonal employee in July and August, and then he went back to college. He was a great employee, but he went back to college, so we interviewed in September, so we currently have another seasonal employee to get us through the raking season, so we should see our numbers go up in October. We were interviewing in September. Our foot care numbers are up. Our assessment numbers are up. Cell phones, we give them out as we get requests for them. Senior assistants, the same thing. We honor them as we get requests for them. We expect to see a jump probably in October, November, when it starts to get really cold. We'll start getting more requests for home heating. Loan closet, we give out items as we get requests for them. Grab bars, same thing. Taxes are done for the year. Our personal emergency response units, people, it's the same as with our home health program. People come and go quite a bit because of the, many of them are frail, so they go in and out of the homes, in and out of long-term care and hospitals. Wait lists, we have a wait list for our homemaker program, and like I said, we have a person on medical leave. Our lawn maintenance program, we have quite a large wait list, 142. Respite 16, that goes up and down though. Some people aren't quite ready for respite, so they get on the wait list, but then they aren't quite ready for service yet, so that's not what you would call a traditional wait list. Some of those people are just choosing to be on the wait list. Personal emergency response units, 57, and the rest of our programs, we have 0.
Georgia, how do you adjust I see that you have wait lists and you have June, okay?
I'm sorry, that's supposed to be September. I'm sorry. Yep.
Thank you.
Yeah.
That was it.
Yeah. Our transportation, we started a pilot program September 1st, 2009, and we've been hearing from different people how they need transportation. They need to be able to go to different places at different times, sometimes odd times, like they might need to go to their doctor or surgery and they might need to be there at 6, or they might need to be there at 5 in the afternoon. So we heard from enough of our clients that we felt that we need to look at some kind of transportation that was a little bit more flexible. So we worked with a couple different cab companies and some home health care companies to offer a coupon-based transportation program where we sell $120 worth of coupons on a sliding fee scale, so it's based on the client's ability to pay, and that's 3 months' worth of coupons. Their value is $5 each, and they can hire a cab or a home health care agency and pay whatever the cab or the home health care agency rate is using their coupons. And that allows them the flexibility to come and go as they please, and not, it's not as rigid, and there aren't as many criteria, 8 to 5, if there's someone available to drive them. We didn't have to get into the transportation business, which we really didn't want to do. So we have a list of providers, and we welcome any new providers to add to the list. We've already had one other provider added to the list. The home health care companies are added because they can assist a person if they're frail, they can't get in and out of their home by themselves, or they need assistance getting their wheelchair out or their walker into the cab or the home health care company car. They can have an aide go with them, or if they need someone to sit with them, or whatever reason they might need an aide, the home health care companies can provide that aide. So there's a different level of transportation, but that's also available, and they can use their coupons to purchase that also. Our goal is to have a total of 75 clients. It's a 3-month pilot program. At the end of September, we had distributed 610 coupons, which was about 25 clients. And I know since then we've distributed a lot more in October. I don't have those numbers yet. And a survey is going to be completed at the end of, we start at the end of October to see if people were going to value that service, or if it was, if we should continue or not continue, basically, is what we're looking at. So I can provide more information at our next meeting. Commission on Aging is also looking at partnering with the Northwest Michigan Transportation Alliance. The Alliance put together an agreement, and we forwarded that on to Bob Cooney for legal review. Once he gets it back to us, then the Commission on Aging Board will make a decision on whether they want to partner there or not. We also just recently purchased $3,000 worth more of Beta passes that we also sell on a sliding fee scale for those people that like to ride Beta. We did purchase some passes about 2 years ago, and those have all been used, and that was also quite a popular, I don't want to call it program, but a popular type of assistance. So we did go back and purchase more of those, and we have people coming in to get those also. Marketing plan update. Our annual report mailer was sent out at the end of August. I'm guessing that you probably all got one in the mail, but if you didn't, I included one with your packets. We had a lot of positive comments about that, and a lot of, gee, I didn't really know you did all that. So I think that piece was worthwhile to send out. We're working to put together a PowerPoint presentation so that different staff people or board members can go out and make presentations, and we'd all be giving a consistent and same message. And so if I'm not available to do something, someone else could give the same message to different groups of people. And then we did, at the request of either Commission on Aging or this committee, I'm not sure which, we solicited written quotes. We use a marketing consultant for some projects, and we solicited written quotes, and our board decided to end up staying with the current vendor that we're using, Lawton Gallagher Group, for 2010. We did have some 3 groups come in and gave very good presentations, so we may at some point use some of those other vendors for special projects or things that we need to do, if they're a lower cost. So we'll still be looking at them and may use them for special projects. 2009 client survey. Each year we do a client survey. We send out a survey to all our clients. We make it a contest and offer a gift certificate to the pie company for those that turn their coupons or their surveys in. If they turn them in, we have a drawing. And we do that to encourage people to turn in their surveys. This year, for the first time, we went with a consulting group, outside staff, so that we made sure that it was completely objective. When surveys are coming in to our clerical staff, and then they go to our supervisory staff to compile, not that they would, but they could, if they had a bad one, they could put it in the shredder, and so we wanted to get away from any of that. So we contract with a Woods Consulting Group. They sent out the surveys, they received the surveys, and they compiled the results. Of the 1,157 that were sent out, we got 665 back, which was 57.5%, which I think is a great return. The scoring range was 1 to 5. 4 to 5 is excellent, 1 to 3 needs improvement. Our lowest score was in our home chore program, which is 4.06, which is still excellent. Our highest score was 4.76 in respite, and our average score was 4.37. And we attached that survey to your report, so you should all have a copy of that. We shared that with our board a couple months ago, and very pleased with the results. And, every survey that we get, we also have room for comments. So we look at those comments and try to decide ways that we can improve our services, or that was one of the reasons why we started the taxi program, because we kept seeing requests for transportation. So we look at those. Lots of times we'll get a request from a client on a survey, gee, I need help with this. So we help them get that. If they put their name on the survey, we help them get that. So lots of times the survey serves a number of different causes and helps people that might not get what they're needing. So we learn a lot from the surveys every year, and we feel like it's a helpful tool for our office. Our millage campaign is in progress. We had a millage committee meeting October 15th. We're scheduled for another one next week. Our fundraising has begun, which is the first step, because we can't do anything really without money or supplies. The committee chairs have been selected. They're Chris and Ralph Safradini. And Ralph and Chris are our committee chairs for the millage committee, but we have subcommittee chairs that are also being selected. And different groups have started basic work, not a lot of work, except for the treasurer has started her fundraising work. I'm waiting for first year millage estimate for Lori Spencer to finalize our ballot language. Part of the ballot language is you have to have what estimated revenue generation for the first year to put in that ballot proposal. So Bob Cooney reviewed it from the legal perspective. Now I need Lori's estimate for the financial part of that. Once I get that, then I'll be able to bring it to you and to the Commission on Aging Board for approval. I know Lori's having a hard time with the estimates for next year because of all the weird things that are happening with the economy. So that's the one thing I'm waiting for. Once I get that, I'll be able to bring it to the county board. And we're working on a budget and a timeline. They're being developed right now.
Georgia, I'll make a call to Lori today to kind of see where we're at with that, okay?
Thank you. I know she talked to me earlier about they're really having a hard time because of the economy. But that was a while back, so maybe she'll have some numbers.
Okay.
Thank you, Dennis. Prescription recycling, we are very thankful for Grand Traverse County Resource Recovery and 2 local pharmacies, the Medicine Shop and Prescription Shops, who are now taking back unused medications. We've been working with a group of people that actually started working because of groundwater concerns and ended up getting into prescription recycling, and because some of the fish are being mutated, and which is starting to concern some people, so we started looking at prescriptions, started working with Resource Recovery, and they were able to get 2 local pharmacies to take back all unused medications except for controlled substances. And the reason why this is important for the seniors that I serve is lots of times they'll go to a physician for pneumonia, for instance, or diabetes, and the medication they're giving, they use it for a week and it doesn't work. So then they go in and they get a different medication, and that might change something else that they're taking. So they would have all these medications that were unused. The doctors can't take them back, the pharmacies can't take them back to reuse. So the old thinking was that you flush it down your toilet. Well, it's not good for the groundwater, it's not good for your drain field. If you have a drain field, it actually can destroy your drain field if you put antibiotics down it. So we were trying to figure out a way that we could get these prescriptions from being flushed down the toilet. So we've been doing a little educating, doing some investigating, and this is our first step towards that. We're also looking at ways that we can take back the rest of the controlled substances and illegal drugs that someone might find in their home that was their children's. They don't want to turn in their children, but they don't want that stuff in their homes. So we're trying to find a safe and legal way to do that. So we're still working, we're still meeting. Like I said, Grand Traverse County Resource Recovery has been wonderful, and Bob comes to our meetings, and he's been a big help, and he's the one that actually got the 2 pharmacies to take that.
Georgia, I've taken them to Glenn's too.
Glenn's? Oh, Glenn's will do that too? Okay, thank you, Dick.
They probably sold them back to me.
I don't think they can do that. There is a group working in Michigan to try to get, if people return medications, like if their loved one passes away and the family member will bring them back, he's been working to try to get those to be reused. But I just, in talking to pharmacists, I just don't see how that's going to happen because you can't tell if they've been tainted or.
That's true.
We are encouraging a lot of our clients to bubble pack their prescriptions, so that's another thing that we've learned from this process, so that if they might have some memory issues. I know I take one medication and I'm always so much in a hurry in the morning, sometimes if I don't get it out, I don't remember if I took it or not because I'm in a hurry trying to get ready. And so the bubble pack, you can see whether it's been taken or not, and your family can see. So we're encouraging people to do that. There's no charge at a lot of pharmacies to do that as well. We received an anonymous donation in September for $20,000 for home heating assistance for seniors. This was an unsolicited donation, so we were very excited. I mean, we'd be excited for any $20,000 donation, but we were very excited to get this money. So if you know of any seniors that need help with their home heating bills, we have extra help this year. So we're very excited about that.
Excuse me, Georgia. I just can't recall the answer to this. Is this, I know for most departments, the county board has to accept donations, like we just did with Fred. But I honestly don't know whether that's necessary for your department or not. I don't know if it's different because it's a millage department. My suggestion would be...
You know, honestly, Dennis, the anonymous donor has given money in the past.
I know.
And we've never...
I know.
To others.
I know, it just kind of occurred to me.
Accepted
Well,
And does
one
it go
was
into
to
a
our endowment.
foundation? Does it go into an
One was to our
endowment?
endowment, this one did not, and the last one did not.
Well, my suggestion would be, just to be safe, if the committee would just accept it. I think that would be a good thing to do, and then that way, we'll check it out with Bob, just to make sure. I'm not worried about the last one,
No.
but just to be on the record with it, I think is a
All
great
right,
idea.
I'll make a motion to accept the gift for $20,000.
Support.
Discussion? All those in favor, aye.
Aye.
Opposed, same.
Can I ask a question about that? So then if we get another donation, should we take the check but then bring it to the county board? Or
I'll
you're going to
check
find that out, but would we tell the donor anything or just?
I always
take it?
encourage, anytime you get a check, cash it. Put it in the bank, put it in the bank. In other words, don't wait.
Okay.
Don't wait.
that thing.
But then come back and have it ratified with the county board.
Okay.
I have yet to see the county board turn down a donation, right?
yes.
So, but I just think, I know that under some of our departments, by law, the board is the only legal body to accept a grant. And I don't know if it's true with you, but this way we're safe. And I'll check it out and I'll let you know.
All right, thank
Okay.
you.
Thank you, Dennis. I
didn't know that either, so. Other updates, we talked, I think 2 months ago I was here, and we talked about snow removal at the Beta bus stops. So I did some research and talked to Tom Menzel and talked to our staff. And after doing some research, we did find out that staff doesn't recommend doing this, and there were a number of reasons. Number one, there's a major liability issue for the county. The second is, our priority is for seniors, so we would have to serve our seniors first, which would mean that the Beta stations would have to go without snow removal until we got our senior routes done. The third thing is, there's 5 sites that are out of the county. They're in Sutton's Bay, Northport, and Empire, so it would be, you know, a real time-consuming effort for us to take our crews outside the county to do that. And Beta, we did find out that Beta does have one employee that does clean out the sites, and we also found out that when the stations were set up, the sites that they're set up at, like, for instance, Myers did, the different sites agreed to keep those stations clean and free from snow. So my recommendation is that we would not need to do that because they have other avenues in place. So I just want to let you know about that. The next thing is, at our Commission on Aging Board meeting in October, we talked about universal or floating workers to help cover different services. Mainly, I think we were talking about home chore and homemaker and maybe intermingling those two employees. So I met with HR yesterday. I got a job description from the pavilions. I haven't had a chance to look at that yet. But we're going to investigate that and take it to our program committee. The other thing I did want to let you know is we do currently use what we don't call them floating workers, but that's pretty much what they're called. For our respite, our home health, and our foot care programs, our foot care nurse fills in for home health and respite when she doesn't have foot care. And then our respite and our home health aides interchange. They do both. If home health isn't full, they'll do respite. If respite isn't full, they'll do home health. So we do interchange those workers, and our foot care nurse does help out when needed. So we do that in those programs already, and we're looking at homemaker and home chore. And I also believe at the same meeting, we had talked about a sign for our contractor. So we did get a sign made, and our contractor is proudly displaying our sign on his truck when he's providing services for us. So thank you for that suggestion. And I haven't seen his truck, but I've been told that it's on there, so
Great.
we're doing that now. And then thank you for awarding us our millage interest. We really appreciate it. I know our board was happy to hear that, and not sure what we're going to do with that next year. I didn't have it budgeted, but I may end up using it to fill the gap for our, probably our millage shortfall if things are going the way Lori says. So, but thank you. Our story of the month, we got a letter in our office October 22nd, and it was from a child of a client. And she says, "Dear Sir, Madam, we have been fortunate to have been using your services for in-home respite care for my mother, who has Alzheimer's, since approximately March of this year. When we started with you, I did not know what to expect as far as care. You assigned Brenda Voigt to our case, and we have been very happy with her help. Not only has she been able to take care of my mom and thus give my dad a much-needed break on a regular basis, but she has also been there for my dad. When Dad needed to talk about his frustrations, Brenda was there to listen. When he just needed someone to visit with him, she filled that need. Her compassion and caring for my mom was evident in how she interacted with her. In conclusion, thank you. Thank you for offering the service to all who need it in our community, but mostly, thank you for having such a wonderful, caring person assigned to our family. Brenda is an angel in my book. If a future client ever wants to talk to someone who had Brenda in their home, please do not hesitate to have them contact me. They can reach me at my phone number below. Sincerely, Susan." So, and Brenda's been wonderful. All our employees are equally as wonderful. I feel so lucky to have so many great employees. So, and we get these kind of stories every week. And I have no further action items. George, do you have anything that you would like to add?
No, I can elaborate a little bit about those beta stops. When those shelters were set up, that was one of my responsibilities to do that. And with all of the locations that we set them up at, whether they were a private party's property or a governmental unit of some kind, they all agreed to maintain their own shelters. So I'm quite sure that that should continue, but I haven't been in contact with them this fall.
All right.
If I could just comment on that, I mean, one of the reasons we started that discussion, I think, is because the new Beta director had made some comment about not knowing where he would find the staff to shovel out the bus shelters as winter approached, so maybe he wasn't aware of the agreements already in place, I'm not sure.
All right. Anything else? No questions? Thank you.
Thank you.
There's our crew out leaf removing.
And next on our agenda is another opportunity for public comment. Seeing none, unfinished business. Nothing. Other, nothing.
Move for adjournment.
Adjournment.
Record meeting.
Support.
All right.
Good job.